Thank you. Good evening, friends. And we'll begin with this talk on allergic rhinitis. So basically, allergic rhinitis is not a single term, it's a syndrome. It is a syndrome by the means of sneezing, nasal block, and nasal discharge, what we find in response to an allergen, and medically we call it an antigen. And the incidence has been increasing over the years, that the number of people getting allergic rhinitis is very high, and how it does not limit itself only to the nose. It goes to various different parts of the body, and I'll briefly take you over to all this. So allergic rhinitis is a condition which affects the quality of life. The loss of man days is very high, and it's one of the 10 commonest conditions that lead to the doctor. I mean, the patients coming to primary care physicians. It's one of the probably topmost conditions which leads to this. It's quite a frustrating condition. It's quite a frustrating thing where allergic rhinitis may just go on and on for years, decades, etc. Now, the reason is that with industrialization, etc., the quality of the percentage of allergy has increased, and from 20% it has become 45% as far as many of the international reports say for Western countries. And even in India, the incidence, which was earlier 10% of the population was affected, now we find about 25% of the population being affected because of this. So that gives you an idea to the enormous involvement of allergy or allergic rhinitis. And as far as allergy is concerned, globally the number is huge. It's massive. In our country, the incidence has increased, and even newer reports show that from 25% it has gone to 30%. And amongst all the allergies considered together, allergic rhinitis as a single entity is the highest involved allergy for any particular area in the human body. So 55% of allergy is actually allergic rhinitis, and therefore the importance that we'll go through it in today. Now, the changing scenario today is that we have, with the usage of mobile, our whole activities have reduced. We have the body weight has increased, the BMI has increased, and that is changing lifestyle that has led to increase in the allergy. And I just go into the various conditions why this is occurring. So medically, it's an IgE mediated response, which leads to inflammation of the nasal airways in response to a stimulus. So it is an immunoglobulin, that is IgE mediated response, which leads to inflammation of the respiratory tract. Now, particularly, especially even in the elderly population, what we call is they suffer from chronic rhinosinusitis. What happens that there's certain inflammatory cytokines in the body. You must have heard of IL-6 and all, which was very commonly discussed during our COVID times. We find even the neutrophilic inflammation is high, and with that immune response to the pathogens, this leads to blockage of the nose and blockage of the sinuses. So persistent allergic rhinitis, as I said, may be a frustrating experience. People go from doctor to doctor, doctor to doctor. And this is like one of my patients who was an electrician. I mean, he was so frustrated with his nasal block. No medicines were working. And he just devised a wire which used to keep his nose open around the nose, around the head. And only then did he get sleep. So nasal blockage or persistent can be that frustrating. Now, basically, what are the symptoms that lead to these allergies? As I said, it's a triad of sneezing, nasal block, nasal discharge. Along with it, there may be even lacrimation, that is, the eyes get red or congested, or there may be congestion, or you can say urtic area, or the skin gets inflamed. So typically, these are the things that one would diagnose allergic rhinitis. We do not require any investigation. We do not require any form of even scan to find out whether it has this is allergic rhinitis or not. The diagnosis is written on the face of the patient. To avoid it, frequently we are told that we should keep the bed sheets clean, wash our hands, etc. Now, the common allergic triggers in our day-to-day life would be strong smells, dust, a humid climate, dust mites, molds, various pets, plants, the pesticides that are used, smoking or tobacco smoke, and certain food and medications. But the globally most important allergens that are seen are the house dust mites. There would be pollen or the grass. Typically, we see it during the fall season, etc., or even when the pollens are very high in few of the countries. The pets which are there around us are strong allergens, cockroaches and molds, which also lead to various antigens which are released. Now, common foods that we eat, one has to be careful of those who are allergic. They have very high incidence of milk being an allergen, milk and milk products that may be like even cheese, buttermilk, etc. Okay, because milk is again an animal protein. It is not for human consumption, and therefore it's a strong allergen as far as human beings are concerned. Then eggs, fish, crabs, almonds, peanuts, wheat, and soybean. These are the common food allergens that lead to allergic condition. But however, what you require to know is the new allergens. The new allergens include the various air conditioners. Now, practically most of the places where you go, you find air conditioner fitted. The rooms are closed. So the air conditioner is a very strong media for the allergens or the fungi or the molds to grow, because it's a dark, closed, moist cavity where these ducts and all, or even the filters are full of dust. They are harboring, or it's a media for allergens to grow. And that is one of the very common causes of allergic rhinitis. Day-to-day life, the usage of various deodorants or perfumes, because all of them contain propane or butane as a propellant where the sprays are used. The various antiperspirants, they contain aluminum salts, and which are again very strong allergens. Even in talcum powder, like asbestos and all is used, which is not only an allergen, but is found to be carcinogenic also. So the usage of various deodorants, perfumes, talc powders becomes an allergen. To add to the list, there are the mosquito repellents, like the various products you see, or even the coils that are burned to uh, drive away the mosquitoes. Even the incense sticks may contain chemicals, and those fumes trigger an allergic rhinitis attack. The new allergens also includes the various processed foods, the foods which are supposed to have a long life. And the reason is that the allergens in the food are the colors which are given to it to make it look attractive. The various flavor enhancers put in these foods to, of course, so that they sell better. The various preservatives put so that they have a better shelf life. They can be kept in the stores for 6 months, 1 year, etc. So all these act as allergens in the food, and therefore it is important that we have to eat what is grown on plants and what is not made in plants. So all processed foods, packed foods are strong allergens, which, needless to say, should be avoided. Now, when we consider the nose per se, the lining of the nose is not just isolated. As you see in the picture, from the nose, the lining goes into the sinus, it goes to the ear, it goes to the throat, and finally to the lungs. So from the nose till the lungs, till the sinuses and the ear, you have a single continuous mucosal lining. So what happens with these things is that if you see, the mucus constantly flows out of the sinus, which goes down into the throat, and we swallow it. But so if the sinus is blocked, it leads to sinus infections and various polyp formations. So that is how this happens. So typically what would happen, that starts off as a basic allergic rhinitis, where certain chemicals are released in the mucosa, and these cause inflammation or swelling. And thus inflammation or swelling of the sinuses leads to sinusitis, what is commonly called as sinusitis. And if the sinusitis persists for a long, the secretions get infected, pathogens form, and they solidify inside to call it chronic sinusitis, or it leads to a polyp formation in the sinus. So if you see, basic allergic rhinitis is just inflammation of the lining of the nose, but when there is inflammation or rhinosinusitis, the opening of the sinuses, you can see the infection in the pus, and that remaining for a longer period leads to solidification, which forms typically a nasal polyp. So it is inflammation that leads to this. Now, there are also various non-allergic causes which lead to the similar complaints. So vasomotor rhinitis, which is termed as. Now, vasomotor rhinitis is again a triad of same sneezing, nasal block, nasal discharge, but there is no allergen. There is no stimulus. So what is the cause of it? There are hormonal causes of vasomotor rhinitis. Hormonal would mean that you see more congestion of the nose, typically like during menstruation or during pregnancy. Or in fact, there's a condition which is described as also as honeymoon rhinitis. There may be overuse of local medications. People have habits of using inhalers or sticks. They keep it in their pocket and they keep on snuffing it, or even snuff, etc. They keep on smelling it for opening the nose. The overuse of that leads to vasomotor rhinitis. There may be atrophy or drying of the nose due to bad local hygiene or even vitamin deficiencies. It may be drug-induced nasal congestion, like for example, some of the antihypertensives, some of the decongestants, they can cause nasal congestion and even a deviated nasal septum. So one of the studies which we had done a few years ago, we found out that 98% of the physicians all over, we've done it for in about 25 cities in the survey, that 98% of the physicians in our country believe that allergic rhinitis was the cause of repeated respiratory tract infection, and we need to address allergic rhinitis as a single entity itself. Now, what happens? This is like you're going on a long journey on a road with on a cloudy night, and on the cloudy night, when you are in your car, you see one of the indicators on the dashboard start flickering. So when you see an indicator coming, there are two options that you have. Either you continue driving, or that when you see an indicator, you go to the side, park your car, open the bonnet and see whether there is enough engine oil, petrol, the connections are fine and connected, and then go ahead. So basically, this is something like that. This is just a symptom that you're getting earlier. And if you find out what the reason is and correct it, it will prevent a lot of conditions happening at a later date. So this is just to show you that how a nasal block causes this problem. So you can see how when there's obstruction of the nose, the passage is open. The passage of sound leads to production of sound, what we call as snoring. This is typically snoring occurring in the person. So snoring is one of the common things that may happen with a nasal block. And long term, this leads to a condition which is obstructive sleep apnea. Obstructive sleep apnea is when there is cessation of respiration for, you can say, about 10 seconds. And this is there for at least, you can say, 8 to 10 times in an hour. So if that occurs to that frequency, a person is labeled with OSA, or obstructive sleep apnea. This is one of the precursors to type 2 diabetes, to hypertension, and to various other metabolic syndromes like hypercholesteremia, hyperlipidemia, etc. So what happens that when the nasal passage is open, air would flow from the nasal passage directly into the nasopharynx to the throat and goes down to the lung. But with allergic rhinitis, the nasal passage, you can see it is reducing in size. And as it reduces in size, the nose becomes narrow. And as the nose becomes narrow, that negative pressure would pull the soft palate backwards. The uvula hits against the pharynx, and even the negative pressure pulls the tongue behind. This also leads to opening of the mouth and mouth breathing during sleep. So this production of sound of snoring comes from primarily the soft palate hitting against the pharyngeal wall and the base of the tongue, which leads to snoring, mouth breathing, and reduction of oxygenation as far as the whole body is concerned. There's a greater load on the heart also. So what is required is we have to treat the nose so that the nose opens up, oxygenation becomes adequate, and that will make the tongue come in front and the mouth closed also. So that will be the main form of treatment that we require to do. So this is what happens that if this is the nasal septum and this is the lateral wall of the nose, and you can see the large turbinate which typically occurs with allergic rhinitis. This is how the turbinate should be. It should be smaller in size. So here, of course, immediately you can see it is reduced by laser. Again, it is further reduced and the turbinate is practically down. This is a gauze piece inside. So it is this obstruction. You can see the obstruction is so severe that hardly any space remains there in the nose. So nasal breathing is important. Now what happens that in allergic rhinitis, we can say why it is important is that 80% of them asthmatics suffer from allergic rhinitis and 60% of the asthma patients have sinusitis. So the incidence is to that tune. Now, from the tip of the nose till the terminal bronchi of the lung, you have a single respiratory epithelium. Medically, we call it pseudostratified columnar epithelium with cilia, which clears the mucus. Secondly, the triggering factors in the nose and in the lungs are the same. The same dust, pollen, pollution, etc. Then the chemical mediators to these allergens released in the nose and released at the level of the lungs or the bronchi are the same. And lastly, the drugs acting at both the levels are the same. So allergic rhinitis we see in childhood or in adulthood, if it does not clear, as one grows older, this is the precursor to asthma. So in short, we can say that allergic rhinitis is asthma of the nose, just for an easier understanding. So allergic rhinitis definitely would lead to asthma if it is not controlled and not taken into consideration. Now, since as I earlier said, the lining of the nose is continuous with that of the sinuses, so this leads to sinusitis. Allergic rhinitis leads to then later on polyp formation, leads to respiratory tract infection. All ear infections are occurring because of allergic rhinitis, and finally it goes down and causes asthma. So these are all preventable conditions of allergic rhinitis, which not only leads to asthma, but asthma and other conditions may be obstructive sleep apnea, snoring, that is, then that may lead to hypertension, diabetes, and metabolic conditions. So where there is a wheeze, there is always a sneeze. The nose is clear, the lungs, the airway remains clear, and lungs and airway clearance is very important, and especially in all these viral infections which we have seen with, even in the COVID times and all, where oxygenation plays a great role as far as the whole airway is concerned. Now, if you see the airway is clear and it passes on, even ancient medicine has shown us that it improves the quality of sleep. You can focus better with it. It lowers the blood pressure, anxiety, and the lung capacity is better. So what is important is a clear nose, a clear airway, very important for the whole body itself. And these are all preventable conditions. We can prevent it. It is easier to prevent it than actually after the damage occurring. And prevention is, as you know, the old age is better than cure. So allergic rhinitis is a syndrome. It is on the increase. In the last 2 decades, the incidence of it has doubled. It's fully preventable, quite preventable and avoidable thing. Not only the nose, you have multiple organs that are affected, and it improves the quality of life of the patient. And so therefore it is important to be educated as far as this is concerned, and unless educated, you will not know actually what to do. So simple problem, as you see, this is an actual condition which happened in our patients also. So we have had people using it like this also. So patient education becomes very important.